Hi guys, here's another case that we see frequently at the centre, and here are some tips to help you out at home. I'm introducing you to Nugget in this video. He suffers from severe multi-joint arthritis, a painful condition that affects a dog's quality of life and movement. When Nugget's parents came to see me, they were at their wits' end. He was stiff and sore all over his body, and they were having real difficulty getting the right amount of exercise into him, especially in the colder weather. They had tried the usual veterinary approach to managing osteoarthritis, which involved monthly injections and natural supplements. At the centre, we use a multi-system approach, and a combination of manual therapy, dry needling and home exercises worked really well for Nugget. According to his owners, Nugget has improved out of sight and is now living successfully with his arthritis. His walking ability has improved and he is independent around his home. Nugget's owners finally feel confident in how they are managing his joint issues and his musculoskeletal health. Nugget's elbows, hips and knees have been badly affected by osteoarthritis. This causes stiffness all over and a painful limp. It has made walking and getting up from laying down quite difficult for Nugget, especially as he ages. As a result of his joint complaints, Nugget gets sore in his back, so when he comes to see me at the centre, it's important that I assess his whole body before I commence any treatment. I perform a quick neurological exam to check his reflexes. Then I assess the range of motion in all the joints of the hind limb, along with evaluating Nugget's muscle mass and tone. It's imperative that we keep Nugget's rear legs strong to enable him to move independently. You can see in this video that the spinal muscles are twitching a lot when I palpate them. This indicates soreness. Keeping Nugget's back pain under control is an important part of his physio management plan. I also check the muscle mass in the shoulder region and assess the range of motion in Nugget's front legs. Unfortunately, his elbows are severely impaired with regards to their movement and are a primary source of Nugget's problems. When the elbow joints are affected by arthritis, it's important to pay attention to the tricep muscle group and around the ribs. When massaging the triceps, use a flat thumb or finger as opposed to fingertips, as the latter could be uncomfortable for your dog. Focus on the front of the chest to release the pectoral muscles. Then massage up the scapula to the tips of the shoulder blades. You can then see me perform some spinal adjustments in Nugget's thoracic spine to help maintain flexibility with his ongoing limp. Because Nugget has hip and knee osteoarthritis, it's important to release the large muscle groups in the hind limbs. Firstly, I start with the gluteals and lumbar epaxials. Then I work on the hamstrings. Back to the gluteals, and finally release the quads and hip flexors at the front of his thigh. You can see there is a lot of muscle twitching and soreness around the ribs and their connection to the spine. So that's where I focus my gentle manipulations during Nugget's treatment. I perform a variety of dorsoventral and rotation mobilizations, which have been really important in managing Nugget's arthritis and allowing him more freedom of movement throughout his whole body. Lumbar spine release has been really important in helping Nugget during position changes, such as sitting and getting up from lying down. The lumbar region is often an area that gets forgotten about, so here's a gentle reminder to focus some attention here. Nugget's owners both realise the benefit of maintaining a strong musculoskeletal system, as they are both fitness fanatics themselves. So they were super keen to take on a home exercise program for Nugget, which they have been very diligent in doing. Although joint disease has caused loss of range of motion, raised poles have been very helpful in maintaining current range and the appropriate strength to flex and extend the joints of Nugget's legs. Lateral work has been important for shoulder strength, combined with weight transfers and flexibility through the rib cage and thoracic spine. Sit-to-stands have been important for Nugget's hips and knees, along with active neck movements to preserve tissue flexibility and comfort. Nugget is a really great example of how a multimodal approach to arthritis can lead to great outcomes. There's no doubt he's living his best life, and he never forgets to remind his owners when it's gym time in the evening for his daily home exercise practice and treats. Thank you for watching this video. Please like and subscribe if you wish to see some more.